Welcome to the Deep Dive. Our mission, as always, is to take a huge pile of sources, articles, studies, all of it, and just boil it down to what you really need to know. Today, we're zooming in on a place that's pretty much synonymous with speed and ambition, Hong Kong. But we're looking past the skyline and the crazy high rents to unpack a different kind of cost, the psychological price tag.
Exactly. I mean, when people think about the cost of living in Hong Kong, their minds immediately go to real estate. But what our sources are showing is that the constant high-stress environment, especially over the last few years, has had this profound effect on people's well-being.
Right.
It's created these really measurable economic consequences and long-term health burdens.
And the material we've got asks this huge question. What happens when that kind of stress stops being a crisis and just becomes chronic? What does pandemic fatigue even look like when it drags on for years? And the big one, how much is treatment-resistant depression actually costing a major global hub? Okay, so let's unpack this.
Well, we have to start with the elephant in the room, right? The city's whole zero COVID approach. That wasn't just a policy. For the people living there, it was a massive psychological event.
The sources describe it as this widespread, just sustained pandemic fatigue. And we're not talking about just being annoyed with masks. This is about being completely worn out from being on high alert all the time.
All the time. The constant testing, the quarantine rules changing overnight, that fear of being sent to an isolation center. It meant people were just in the state of perpetual vigilance.
And that kind of sustained stress, it genuinely elevated people's perception of risk, didn't it? Even after things started to open up.
Oh, absolutely. And what's really fascinating is how it just destroyed the ability to plan. I mean, planning is so fundamental to our mental stability, right?
Mm-hmm.
But the strategy forced you into this constant stressful micro-planning around restrictions. When the rules can flip overnight, all predictability is gone.
It's that feeling that your life is just being controlled by these outside forces. The sources really highlighted how heavy this was for younger people.
Yeah, imagine trying to build a career or finish your degree.
How could you? It's like your entire future just gets put on indefinite hold.
And this is the key point, that fear didn't just evaporate when the mandates ended. The material calls it the stickiness of fear. People didn't just snap back to normal.
Right, they kept masking, kept their distance, partly out of habit, I'm sure.
Partly habit, but also this lingering anxiety or sense of personal responsibility. And that emotional footprint, it shows that this kind of stress from long-term policy, it doesn't just go away, it gets into your nervous system.
It's so easy to just focus on the human side of this.
Yeah.
But what happens when you actually put a number on it? Let's get into the financial consequences.
The projections are pretty sobering. I mean, they're looking 10 years out. The studies forecast that Hong Kong is going to have this stable but very high rate of depression for the next decade.
How high are we talking?
We're talking somewhere between roughly 56,000 and 58,000 people living with clinical depression every single year until 2032.
That's a huge number. And the cost.
The all-cause healthcare costs, so that's everything from GP visits to hospital stays, they're projected to be over HK $2.51 billion a year.
Wow. $2.5 billion every year.
Every single year. And that's just for depression-related care. If you drill down into just the psychiatric care, it's about HK $473.5 million annually. And the sources are really clear. These numbers are expected to hold steady without some major new interventions.
That's an astronomical figure. But
yeah.
Is it fair to pin all of that on the stress of the last few years? I mean, Hong Kong has always been an intense place to live.
That's a fair question. And yes, it's a high-pressure city. But the analysis points to one specific thing that's inflating these costs way out of proportion. Treatment-resistant depression, TRD.
Okay, tell us about TRD.
Yeah.
This sounds like where the real financial story is.
It is. It's the cost driver. So TRD patients are people who haven't responded to at least 2 different initial treatments. They're a minority, less than 20% of the total depressed population. But, and this is the kicker, because their care is so much more complex and long-term, they drive a massive, disproportionate chunk of the total spending.
How disproportionate are we talking?
We're talking between 31 and 54% of all the spending on depression. So think about that. A fifth of the patients are responsible for potentially more than half of the total cost.
Wow.
It just screams that there's an urgent need for better early intervention. We're basically paying this massive long-term price because people are falling through the cracks early on.
So the costs aren't spread evenly at all. And there are specific groups who are bearing the highest burden.
Absolutely. The data shows these clear divides. On one hand, you've got adolescents. They have the highest psychiatric care expenses specifically. That points to really acute needs among the city's youth.
And what about older people?
Yeah, then you look at older men, 65 plus. They face the highest individual all-cause healthcare costs and the highest mortality risk, especially if they already have other health conditions. It's the severity and the duration of the illness that's really driving the economic strain.
Let's shift gears for a minute and talk about the experience of, well, of people living and working there from abroad. The expat community. Their whole support system is just fundamentally different.
For sure. I mean, being an expat in Hong Kong already comes with its own anxieties, and the last few years just poured gasoline on the fire. Imagine trying to navigate those constant policy shifts when you barely speak the language.
Or trying to explain the quarantine rules to your worried family back home who are just seeing these scary headlines.
Exactly. The sheer mental load of just the administration of your life must have been exhausting.
And for expats who often don't have those deep local family networks to lean on, it was incredibly isolating. One source said it felt like trying to build a house on shifting sand.
That's a perfect description. And then you have to stack the financial pressure on top of that psychological load. It's not just the rent, it's worries about job security, your kids' education. Right. And in an environment where everything feels unstable, the rules, travel, all of it, people instinctively try to control what they can. The sources noted that finding a stable living situation becomes critical.
You mean like a predictable home base?
Exactly. For a business traveler or a professional on a longer stay, having something reliable like a service department or an extended stay solution, it isn't just a luxury, it becomes a massive piece of the psychological puzzle. It's about creating order when everything else is chaos.
It turns this totally unpredictable situation into something manageable. If you know your housing and your basic logistics are stable, it just frees up your mental bandwidth to deal with all the other uncertainty.
100%. But even with that, the cumulative effect of all these stressors often leads to anxiety, burnout, depression, and then trying to find mental health support in a system you don't understand just adds another layer of strain.
It's a dense web of stress. The sources talk about feeling disconnected, the difficulty adapting, managing family needs from so far away.
So if we kind of connect this all to the bigger picture, we have to move from just analyzing the damage to talking about solutions. And the biggest takeaway from all that economic data is timely support. Getting help sooner prevents people from sliding into those more serious, costly conditions like TRD. It's a no-brainer, really. It saves money. But more importantly, it improves people's lives.
So it's about shifting from being reactive to being proactive. What kind of strategies are we talking about?
Well, the sources point to things like school-based counseling projects, which offer mental health training and support to students. It makes perfect sense, right? Address the youth who we already know carry the highest psychiatric cost.
The sources also brought up a really interesting dynamic about trust, the erosion of trust in official guidance.
Yes. And when that trust in official channels goes down, individuals are forced to become radically self-reliant. You basically have to create your own safety protocols, which is mentally exhausting to maintain long term.
The burden of vigilance just shifts completely onto you, the individual.
And that was magnified by what the sources called a moral obligation strain. People felt this immense pressure to be a good citizen, to follow every single rule to the letter, even reporting on neighbors. It came from a good place, but it added this tremendous mental load that often tipped people into burnout.
That was contrasted with something really positive, wasn't it? The community efforts.
It was beautifully contrasted. When the official channels felt overwhelming, you saw these local groups organizing support networks, sharing resources. They became these crucial lifelines for so many people. It really showed the incredible resilience that is there.
Okay, so to summarize this deep dive, we've seen how all this prolonged uncertainty created a lasting pandemic fatigue, a fear that's still visible in people's behavior today.
And we've quantified the economic cost, that staggering HK $2.51 billion a year, which is largely driven by the disproportionate cost of treating treatment-resistant depression.
And we've touched on the unique isolation and strain on the expat community, and how logistical stability, like having a reliable place to stay, became a key coping mechanism.
Exactly. Hong Kong's ability to endure it's amazing. But the sources are clear that resilience is coming at a measurable cost to everyone's mental well-being. And that raises a really critical question, one that ties right back to the city's future. Considering that adolescents are incurring the highest psychiatric care expenses, What does it mean for Global City's future when its youngest residents are carrying the heaviest mental health financial burden? That's something for you to mull over.
A really critical thought. Thank you for diving in with us today.